Welcome to Coronavirus The Rundown. I'm Usher Qureshi. Each day we showcase how American communities are taking on the coronavirus. We also break down the headlines. Today, Alicia Nieves looks at a source of emergency funds for a growing number of Americans.
When Congress passed the CARES Act, it approved billions of dollars in direct stimulus checks, billions more in business loans. But it also approved a provision that would allow people to tap into their retirement fund penalty-free.
The important thing for the CARES Act is it gave Americans some additional options. It gave employers some additional ways to help their workforce get through this tough time.
Nevin Adams is with the plan sponsor Council of America, a nonprofit trade association that surveyed 401k plan sponsors after the CARES Act was passed. PSCA found that less than half of plan sponsors were moving forward with implementing the legislative change, though some were still deciding. It's important to note that while Congress passed the provision, plan sponsors had the option to implement it or not.
The larger you were as a plan sponsor, as an employer, the more likely you were to have decided already that you were going to take some action. And in the most part, those who decided to take an action were, in fact, adding these new distribution and loan options.
What were some of the reasons behind why some sponsors, plan sponsors, didn't want to implement this legislation?
They're concerned about giving people all this ready access to that retirement savings money a little too soon and wanting them to take advantage of other options as they've got them available. And I think there's also a concern, if you think about what's going on in the markets, that for participants to be rushing in and pulling money out of that retirement savings at this particular point in time, they would take that loss.
One of the fundamentals of investing is buying low and selling high. Right now, pulling from your retirement fund would be doing the opposite of that. But for some, it has been necessary.
The good news is, at a high level, even though there has been an increase in those volumes, anecdotally, people are not going crazy about it, and I think that's a very good sign.
Most financial advisors say you really should avoid tapping into your 401k even right now unless you absolutely have to. If you do, and your plan sponsor allows for it, here's what you need to know. The 10% penalty is waived. You still have to pay taxes, though, but those taxes can be spread over the next 3 years, and there is a cap at about $100,000. I'm Alicia Nieves reporting.
Families are struggling financially right now, and the price of medication can take up a large portion of a household's income. There are resources to help with that. The nonprofit Needy Meds connects people with coupons or discounts, as well as programs that may qualify people to get prescriptions for free. About 150 of those programs are expanding their qualifications due to the pandemic. Many come directly from pharmaceutical companies and can depend on whether you lost your job due to the crisis or if you're at risk of becoming infected. You can find those resources at needymeds.org/COVID. Well, more people are turning to credit cards for emergency funds right now. Mark Greenblatt and our partners at Newsy found companies are starting to limit options.
Major U.S. credit card issuers have begun to cut their risks by lowering spending limits on consumer credit cards as the economic toll of the coronavirus continues to unfold.
They really do have a lot of power to change these things, but it's coming at the worst possible time for consumers because a lot of people need these cards to get by.
Ted Rossman tracks trends in the industry for Bankrate and creditcards.com, and he says when your spending limit gets cut, your credit score is also likely to drop.
And that's one of the reasons why it can really hurt you to have a credit limit cut or a card canceled without warning.
Companies like Discover tell Newsy that they're not lowering credit lines for existing customers, but will tighten other lending standards. While Synchrony Bank told investors this on a recent earnings call about its current credit customers.
We're continuing to utilize internal and credit bureau triggers to dynamically reevaluate a customer's creditworthiness.
It means the millions losing their jobs in the wake of COVID-19 may not necessarily be able to count on credit that they have today as a safety net to pay for medical bills or other critical expenses tomorrow. And if you haven't used a card in a while, it may get canceled altogether, whether or not you pay your bills. During the Great Recession in 2008, Rossman says 60% of people with subprime credit had cards canceled or credit limits cut without warning. But surprisingly, the same happened even to 20% of people with good credit. So to keep your access to credit going during the coronavirus pandemic, dust off any dormant credit cards that you might not have used for a while and at least make a small purchase on them. And if you do anticipate real money troubles coming, call your credit card companies right now. Make a plan with them before they cut off your credit. Also, many consumer banks are offering temporary hardship assistance for those impacted by COVID-19, such as allowing customers to defer a card payment and waiving fees. But you still might want to consider this.
I think you really need to preserve cash flow right now, even if it means carrying debt for a time. When money comes in, like the stimulus payment, for example, or your unemployment benefits, I would advocate more than usual for keeping that money on hand, either in emergency savings or for spending on necessities.
Mark Greenblatt, Newsy, outside Washington, D.C.
Well, delivery drivers, grocery store employees, and retail workers are staging a sick-out for policy changes they say will increase safety for employees working during this pandemic. This sick-out is a grassroots movement. It coincides with May Day, which is known for labor movements. Many small businesses are struggling to get a loan under the Paycheck Protection Program, but more owners are finding better results going through a smaller bank. Experts say once you find a smaller bank, call and ask about their backlog so you know how long you'll have to wait. They say big banks are overloaded right now, and some are being criticized for prioritizing bigger businesses.
The smaller banks just appear to have a much more hometown feel, and you're getting things done apparently a little bit quicker than we're seeing at some of the big box banks.
Some business owners are also going through companies like Square or PayPal and say the whole process was done within a week. They're part of a handful of companies in a field known as FinTech that are approved PPP lenders. Well, the SNAP program is getting some major emergency funding right now, so it can help more Americans through this pandemic. We're looking at how long that may last and what the future may hold. And a nurse inspired to help people who are isolated in the hospital with coronavirus. How she's helping families stay connected beyond the occasional video chat.
At theindychannel.com/rebound.
Most coronavirus patients who end up in the ICU are there by themselves, and that means doctors and nurses are the only faces they can see. But Chris Conti shows us how one nurse is trying to cure her patient's loneliness, a picture at a time.
Like a steady falling rain, the days seem to run together inside Lowell General Hospital, where COVID-19 patients are largely suffering in solitude.
When these patients are alone by themselves in their rooms, what do you try to do for them?
We're just trying to stay in touch.
Gina Barbieri is a nurse here. Like her patients, she too is in isolation inside of her apartment. The risk of spreading the disease to her parents and siblings too high.
There was a lot of fear at first, but there's only so long you can be fearful and continue to go to work. So we've just all accepted.
With no visitors allowed inside of most hospitals across the country right now, patients can't see family members aside from maybe a brief FaceTime call. Gina realized she could do something about that with the help of her printer.
Now I just love this printer more than anything. It's just this.
With the blessing of her hospital, Gina has set up a special secure email address. There, anyone with loved ones in the hospital can submit pictures of their family. After work each day, this nurse sits and prints the photos out. With the help of her colleagues, the pictures are then delivered to patients' rooms throughout the ICU.
What do you hope these patients take away when they see these pictures show up?
Just to remember they're not alone. I think it's a positive moment in a very otherwise not positive situation. And I think it probably feels really good for them to know that their family members wish very much that they could be there.
She's calling the idea Pictures for Patients. So far, more than 24 envelopes of family photos have been handed out across the ER.
It's about more than just pictures at this point.
Yeah, I mean, it's just not being alone. I don't think anybody wants to be alone, especially when they're sick.
But sadness aside, this 28-year-old is hoping other hospitals see what she's doing and start something similar.
People are looking for positives right now. There's a lot of scary stuff going on.
It turns out doing good in the midst of an epidemic just takes a bit of creativity. In Boston, I'm Chris Conti reporting.
Many families are in a tough situation as they say goodbye to loved ones during this pandemic. With social distancing rules still in place, many are taking funerals online. One Room has been providing virtual funeral services since before the pandemic. They say they've seen an increase in services since this crisis started.
And what we have seen in the last 6 weeks is just, an incredible spike in people connecting to services online. So it's probably about a tenfold increase that we've seen.
Before the pandemic, these types of services were not meant to replace in-person funerals, but now that people can't gather, this is helping people connect and grieve.
In a way, it's quite sad to see, because there's nothing that replaces being together at the time of a funeral to support each other and to draw together as a community. Nothing replaces a hug.
It can be difficult to prepare for a virtual funeral at a moment's notice, regardless of how families choose to do this. They need to make sure they have stable and reliable technology, as well as setting up safety features that only allows the right guests to see the funeral. Well, the nation's SNAP program is getting some emergency help right now, getting $2 billion more each month as Americans deal with the pandemic. How long will this boost continue, and what's in store for the program? Chris Stewart is looking into the impact as our country works to rebound.
Life can change in an instant. Jenny Showalter can tell you that.
I'm a single mom of two. I have a 1-year-old and a 6-year-old. I basically became a single mom of two overnight. Their father passed away end of October 2018.
She can also tell you about being a single mom, looking for work in a pandemic with 2 kids, now home around the clock.
It's impossible to have hours enough to pay my bills, to pay my rent, to pay my car insurance, to, put food on the table, to buy diapers, buy wipies. I mean, there's so many things that a single mother has to buy daily, weekly, monthly, that food is nearly impossible anymore.
That's why she is one of the estimated 36 million Americans on SNAP. With coronavirus hurting businesses and putting people out of work nationwide, the government is giving SNAP an emergency boost, increasing monthly benefits by 40%.
There's no living high off whenever you're on SNAP benefits.
Amy Jo Hutchinson has lived in poverty all her life. She used to be on SNAP herself.
I also read that each senator has authorized $40,000 for state office furniture and furnishings, and this amount is increased each year to reflect inflation. That $40,000 a year for furniture is $360 more than the federal poverty guidelines for a family of 7.
In February, her congressional testimony on poverty in America went viral.
So shame on you. Shame on you, and shame on me, and shame on each and every one of us who haven't rattled the windows of these buildings with cries of outrage at a government that thinks their office furniture is worthy of $40,000 a year and families and children aren't.
Earlier this year, the White House proposed 2021 budget called for $181 billion in cuts to SNAP over the next decade. The USDA planned to put in stricter work requirements to receive benefits. A move, then they said, would encourage recipients to move towards self-sufficiency. But that was then. Coronavirus is now. While those cuts and changes are still included in the proposed budget, the Department of Agriculture sent us a statement saying, in part, the agency will be as flexible as it can be moving forward. In a time advocates see as an example of why SNAP is important. Whether you're a single mom of 2,
I'll just bluntly straight truth. We wouldn't have any food on the table.
Or someone struggling, now looking for help you never thought you would need.
One of the biggest takeaways that I'm seeing is that the safety net is actually acting as a safety net, right? I mean, it's catching people who have typically never had to rely on assistance.
As far as how long people can expect increased SNAP benefits to continue, the USDA tells us states can continue to ask for the extra money as long as a federal public health emergency or state-issued emergency declaration is in place. Well, one woman's creative idea is now helping healthcare workers.
Oklahoma, Illinois, Massachusetts, Utah, Georgia. Seeing what they're going through gives me a new appreciation.
The solution she came up with after she saw how long hours in masks were hurting medical staff.
NoDiabetesByHeart.org.
Welcome back. With many day jobs on hold, some Americans are using their skills to do good. Amanda Brandeis introduces us to one woman who saw how badly masks were damaging healthcare workers' ears and faces. So she came up with a solution.
While they hope for a healthier tomorrow, healthcare workers aren't letting their guard down.
No, not at all.
As states loosen stay-at-home restrictions, Nurse Brianna Salas and her team at the University of California, San Diego stand ready to respond on an unpredictable front line.
I think it was a calling for me. I really love my job.
But in the face of COVID-19, their jobs have grown more complicated.
It's a whole process. We wear a gown, we wear a mask.
Bouffants and glasses, it can take a toll after 12 hours.
There's, pictures going around with the, mask bruising, but also where the elastic goes around the ears, it breaks down the skin on their ears.
It's a new problem for many healthcare workers, now forced to wear protective equipment for long hours.
I thought, this is what I can do.
When the pandemic hit, Celeste Gray's sewing sanctuary went silent.
I love to sew. I just love being behind the machines.
Then the activewear designer learned about a simple innovation giving nurses relief.
I'm using the fabrics I normally use.
And got right back to work, sewing buttons onto headbands. Called Ear Saver headbands, the mask attaches to the buttons. Celeste asked friends online if they wanted one.
And her niece loved it and told people about it. And then she ordered 50.
The request poured in.
I'm like, oh, I need more buttons.
With the help of her reliable workhorse, she's churning out dozens a day.
600 of these.
I reached out to her, and she actually, she came in and dropped them off the next day.
And now Celeste is saving ears across the country.
Oklahoma, Illinois, Massachusetts, Utah, Georgia. Seeing what they're going through gives me a new appreciation.
It's so simple, but super helpful.
Alleviated one problem. I mean, that's one thing, less thing that they have to worry about. They're just doing their job.
So that we can all have a healthier tomorrow. In San Diego, I'm Amanda Brandeis reporting.
A therapy dog going digital to keep helping people in need. Did we mention that she surfs? We'll introduce you to the pup who is comforting people during this pandemic.
At NoDiabetesByHeart.org.
Welcome back. We end the rundown with stories that remind us of the good going on all around us. Today, meet Ricochet. She's a surfing certified therapy dog from San Diego. She helped start the dog surfing circuit and has helped countless people through their struggles. Ricochet's two main forms of therapy are physical touch and close eye contact, both on hold right now with social distancing. Her handler says she had to come up with an alternative to continue Ricochet's important work.
Even if just looking at her can make someone feel more relaxed, then we're doing something to make a difference. There's just such a need right now.
Judy says she believes Ricochet's work is important and that so far this adapted style is working. She says she's done sessions with kids, nurses, and ER doctors and grieving families. Well, that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Usher Qureshi. Thanks for joining us.